Hello, this is a virtual microscopy slide of a lipoma, and a lipoma is a very common benign soft tissue tumor. At this low magnification view, we can see that this tumor has very rounded, well circumscribed outlines, and it also has a very nodular or a lobulated appearance. We can see these lobules here, and they are separated by these pink hypocellular fibrous septa. Let's zoom in here into one of the fibrous areas, and this is composed of collagen with a few fibrocytes. It's generally very hypocellular and there is no significant nuclear atypia. Now moving on to the lobules. The lobules are composed of mature adipocytes or fat cells. Now these cells look very empty, and this is because the lipid that they contained has been washed away during processing of the tissue into microscopic slides. If we zoom in, we can see that each cell appears very empty and large and somewhat rounded to polygonal, and there is a very small, bland-looking compressed nucleus right at the edge of the cell. In some of the cells, we can't see the nucleus clearly, and this is because of the plane of sectioning. The nucleus may not be caught in that particular plane. And here again, we can see a few small, very bland nuclei. So these are mature adipocytes, and we do not see any lipoblasts. Lipoblasts would be atypical cells with multiple vacuoles indenting the nucleus, and these are not seen here. If we do see lipoblasts, we would be concerned potentially about a well-differentiated malignant adipocytic tumor. Let's learn a bit more about lipomas. Lipomas are the commonest benign soft tissue tumor. They can occur anywhere, usually relatively superficial in the subcutaneous plane, but sometimes can be found a little bit deeper within the muscle, skeletal muscle. Usually, grossly, they are very well circumscribed with this lobulated appearance with a yellow homogeneous cut surface. There is a separate video describing the gross features of lipoma, and this can be found in Pathweb, which is our free online pathology resource. There is a museum with close to 1,000 annotated virtual pathology specimens, and you can register for free. The link is in the video description. Microscopically, as we saw, these tumors are well circumscribed and they are composed of lobules of mature adipocytes. We can see the adipocytes here, which appear very empty with bland, compressed nuclei. The larger tumors may have areas of fat necrosis, so we may see multinucleated giant cells and foamy macrophages. This is due to trauma. And here we can see the very hypocellular fibrous septa composed of collagen, some mature fibrocytes without any significant cytologic atypia. I also want to mention a particular type of benign adipocytic tumor known as the spindle cell or pleomorphic lipoma. They are regarded to be variants of the same neoplasm, and this is also benign, characteristically occurring in middle-aged to elderly men, usually in the region of the posterior neck. And here is an example of the microscopic features, which also features mature adipocytes. But in addition, there are these very bland appearing spindle cells in between, and sometimes pinkish rope-like collagen bundles. And we can also see these giant cells, which are called floret giant cells because the nuclei are arranged in a circle, a little bit like the petals of a flower, and sometimes even more bizarre, large cells with hyperchromatic nuclei that may be multinucleated, and this is the reason why it is called a pleomorphic lipoma. I will now show you a virtual microscopy slide of a spindle cell lipoma. Here is a spindle cell lipoma, which I am outlining with my cursor. This is in the subcutaneous plane. As you can see, we have the epidermis, which is keratinized, the dermis, and the subcutis. So it is well circumscribed, and zooming in, we can immediately see that it is composed of a combination of mature adipocytes as well as spindle cells and some ropey collagen. These spindle cells have very bland, elongated, slender nuclei, and sometimes the nuclei will appear somewhat wavy. They are arranged in these short parallel bundles, and there is no significant pleomorphism in this particular example. We can also see more pink areas of collagen, and let me just move to this area where you can see this pink ropey collagen located between the adipocytes. This particular tumor does not show any pleomorphic areas. Hence, the diagnosis here is spindle cell lipoma, and this is a benign tumor. Moving back to the original lipoma, in summary, this is a benign adipocytic tumor which is well circumscribed, lobulated, and composed of lobules of mature adipocytes without significant nuclear atypia and with hypocellular fibrous septae in between, again without significant cytologic atypia. Thank you.